Once again, thank you everyone for being here, and thank you, Lorrie and Hannah. I'd like to just quickly introduce them now, and then I'll turn it over to them. Lorrie is a board certified music therapist and the Expressive Therapies program manager. Hannah Shefsky is a board certified music therapist as well. We look forward to hearing your presentation. Thank you.
Thank you so much, Devin. It really is an honor to be here and to be a part of this Integrative Therapies webinar series, where we were lucky enough to get to be on the heels of Elise Park last week talking about meditation and how to find ease and calm in your life. That was really beautiful. So thank you, Elise, for all of the work you kind of did before we came here. So it says in our title, we are here today to talk about music. And we all intuitively know that music can have significant impacts on our lives, our mood, our motivation, our connection. Our focus today is about how we, as board-certified music therapists, understand music's impact and really utilize and harness that power to help patients heal and feel and deal with whatever is most challenging in their current situation right at that moment that we're with them. Although there are many evidence-based goal areas that music therapy has been proven effective with, rehabilitation, speech and language, learning, memory, we are really going to focus on music to increase relaxation and reduce stress. So, our goals for today is we're going to really talk about, well, why music? We're going to do an introduction to music therapy. We're going to show you some active interventions and receptive interventions for stress reduction and relaxation. And we're going to look at music therapy at MGH.
All right, and we are going to get started with some music. So this song is called Music Calls Us, and it's by a group called Daughters of Harriet. And I'm going to invite us to join in actively in whatever way feels right to you. So there's some options here of different ways of finding your way in. An impromptu instrument, you might look around and see what you have around you that could become an instrument. Tabletops are great for that. Lorrie's showing us some kind of little box thing. Oh, yep, you can tap things together. You got a great sound there. Also, our bodies are great instruments. Our knees, chest, got fingers to snap, hands to clap. If you feel like joining in with your voice, you can do that as well. I'll be doing simple lines, call and response, so you can join in that way. If you play an instrument, I'm going to be playing in D minor, or you can play along with those notes that are written there. Those are all the pentatonic scale, which means they're all going to sound awesome at any point. Or if sitting back and just kind of taking in the sounds feels right for you right now, then that is perfect too. So you can kind of find your way in whatever way feels best. All right. So right away you might just start to feel the rhythm in your body, whether that's kind of tapping your toe, swaying along, or bopping your head. If you chose to grab an instrument or a tabletop, you can bring that in. Devin's got some cymbals, I love it. All right, I'm gonna sing a line and you can sing it back to me. Music calls us to come together. Music calls us to come together. Can't you hear it calling your name? Try that. Can't you hear it calling your name? Yeah. Music calls us to come together. Music calls us to come together. Come on in, you'll be glad you came. Come on in, you'll be glad you came. Awesome. That's the whole song. So we're gonna sing it one more time. Call and response. Music calls us to come together. Music calls us to come together. Can't you hear it calling your name? Can't you hear it calling your name? I said music calls us to come break it down a little bit. If you got an instrument, play it out. Lorrie showing us you could do some movements too. Whatever feels good along to the beat. One more time through. Music calls us. Sing it with me. Music calls us to come to get. Can't you hear it? Can't you hear it calling your name? Music calls. Music calls us to come together. Come on in, you'll be glad you came. Come on in, you'll be glad you came. Once more, come on in, you'll be glad you came. All right. Thanks for joining me on that.
Yes. So that begs the question, why music? Or maybe it doesn't, because I know for me that really kind of answers a lot of the questions. Music is an incredible modality for therapy or for self-help, because it is one of the primary human functions that's actually processed throughout your entire brain. I have this picture. It was too much to add as a slide, so I'm just going to show you. These are all the areas of the brain where music is processed. We're talking motor, sensory, visual, the limbic system, auditory, obviously. It's really quite amazing and can stimulate areas of the brain that, again, many other modalities can't stimulate. Another major component in music is our ability to entrain to it. This helps us with when people are trying to recover their gait, if they've had a stroke or Parkinson's. It helps us when we want to try to calm down our breath or when we want to really get moving. Music is one of, I think, the most culturally relevant components. It connects us with our identity and with the identity of the people or the places that we come from. Music and music therapy both have decades and decades of research. It works with all ages, tiny babies, even in the 3rd trimester of pregnancy, that fetuses develop their auditory abilities and they can hear sounds, which we know, and it also works with all abilities. So we work with some severely impaired, cognitively delayed individuals who can really connect with us through those innate qualities of music. And it can be accessed independently or in therapy. So that's why music.
All right, so we're going to talk a little bit about what is music therapy. So really, music therapy is taking all of those wonderful things that Lorrie just explained, those impacts of music, and bringing it into a clinical service with trained professionals who can help you think about how music can best support you and your individual needs and goals and music interests. So in cancer care, we really think about that in terms of how music can be supportive to you at all points along the way, whether you're just adjusting to a diagnosis as you're beginning treatment and going through treatment, or in survivorship. Just thinking about all those ways that music can support you along the way. And we actually have a quote here, if Lorrie will add it on, that gives a little bit of the patient perspective. Someone describing kind of their experience in music therapy here at MGH, and they basically said, our sessions grounded my thoughts on why living this day is meaningful and building up strength to continue onward. So the official definition, and then also more just to get a sense of what that experience can be like, how music can be supportive. And so, as we move forward with this presentation, we'll be sharing some music-based strategies from our perspective as music therapists. And some of them, a lot of them are things that you can try independently, as Lorrie said, things you can try at home. And then you can just know that they're all things that you can then take deeper in the context of working with a music therapist, either one-on-one or in group music therapy sessions. So kind of different ways of using music, whether you want those kind of take-home self-care strategies or whether you want to take things a little bit deeper in the context of a therapeutic relationship with a trained professional. So there we go. Let's see. Oh, Lorrie, you're muted.
Thanks. That was my first one. I get like 5 points every time I do that. So we're looking specifically at music and stress reduction. So again, we talked about why music. So one of the other whys is that music really is very effective for both reducing stress and increasing relaxation. And the way it does it is, again, with that entrainment, we can slow the heart rate and breathing. Because music is processed all throughout our brain and has those deep connections to the limbic system where our memories are held, it's a very effective technique for redirecting our attention away from those sticky thoughts that really can cause stress. This is one of my favorites. Music connects to parts of ourselves that are well. Despite what is going around us in the world or what is happening inside of our bodies, there's this part of us that's always well, and music can get to that place. Music also really supports movement. It's an incredibly social experience, and it's just an amazing leisure skill. So all of these different components really have direct impacts to reducing stress and increasing relaxation, maybe in some kind of more unique ways. It's not just like the slow, deep breathing ways, but in all of these other kinds of ways.
And so now to talk about another way of engaging with music. So we started out with a more active music experience, but there are many wonderful stress relief benefits of recorded music and engaging with music by listening. So one thing that we talk a lot about in music therapy is creating intentional playlists to support different goals. So you'll see on this slide some examples of that, songs that bring you a sense of calm, of peace, songs to motivate movement. We've talked about that, to shift our mood, to be creative and express yourself. And in a way, it's this creating those playlists allow us to kind of harness the power of music and get it ready ahead of time, so that in that moment when you feel like you need some support, the songs are kind of organized there for you. And so I want to give us a chance to think about this. Actually, let's think about that movement one. So I'm going to pose the question, if you think about a song or an artist that you just kind of can't help but move to when it comes on. So if you want to even share that in the chat, I'd be interested to see, what artists or what songs that is for you. I would say for me, Stevie Wonder is one of the big ones. As soon as a Stevie Wonder song comes on, I'm just doing this without, oh my gosh, and someone else just said Stevie Wonder. So there you go. He has really nice beats that just kind of give you that like energy to want to start moving. But again, it's all based on preference, right? So it's really individual relationships with different genres and different styles of music. Let's see. I am seeing Meghan Trainor. Let's see, more Stevie Wonder. Awesome. A song called I Remember. Love it. So you were seeing that we have these songs that when you put it on, it'll help you start to move. So creating a playlist with a bunch of those songs can be a great way to have them ready for you. And then I'll add that to kind of even take that to the next level, you can use a concept that we talk about in music therapy called the ISO principle. And the idea with the ISO principle is, and here's an official definition of it, but basically finding music that first matches your current state or your current mood, and then gradually helps you shift to your desired state. So sticking with this idea of movement, let's say, I know that getting moving helps me, reduce some stress, but in that moment, I'm feeling pretty low energy and pretty fatigued. If I started right in with an upbeat Stevie Wonder song, I kind of wouldn't be ready for it. I wouldn't be, okay, yeah, I'm in it. I need to start with something a little bit gentler. So it's this idea of finding a song that might match kind of that state I'm in with a little bit of lower energy, with some of that fatigue. And then gradually the playlist can progress so that it brings me with it to that, my higher energy place. So that can be done with live music. We do that with live music and music therapy sessions, but this is a great thing that you can also do with recorded music. In all of the wonderful platforms that are available now, Spotify, Pandora, even YouTube, you can make playlists. And I see Lorrie has a little something to add. Yes.
And one other way that we can use playlists is also to make them kind of time specific. So if like in recovery from radiation or chemotherapy, or just it's a really hard day and you just want to get motivated, you can set small goals like, okay, I'm just going to get out and I'm going to move for the length of this one song. Then I'm going to maybe work it up to two. Now I'm going to try to, eventually get through this, my favorite album. So that, like, I just gotta, you're not even really thinking about the fact that you're exercising. You're thinking about, oh, at the end of Garden State is my favorite song ever. And I just want to keep moving till I get there. So that's one thing. And then also, many cancer patients and survivors struggle with sleep or insomnia. And the lifestyle medicine webinar series I was a part of, we had several slides about how music can really help with sleep. And the idea of this intentional playlist is a little bit different when you're trying to get to sleep. You have to be a little bit more thoughtful so that you don't accidentally get yourself all excited. So that I know is also up on the Cancer Center's website. So you can take a look at that if you want to learn more about that.
Awesome. So I think we're going to shift now to another more active way of engaging with music, which is singing. So you might have already done a little bit of singing with us at the beginning with that first song. But I mean, singing really just has so many wonderful benefits, even starting just physically. Singing has been shown to reduce all those feel-good hormones, oxytocin, endorphins. It really has been shown to lower blood pressure, has that calming effect. It encourages us to take deep breaths because we need to take deep breaths in order to sing. So just starting to sing right away gets our blood circulating, gets us taking those deep breaths. And then also, of course, kind of the more psychological benefits, kind of the feelings of connection when you sing with other people, which we know that these days the virtual singing is a little bit different, but we figure out ways to make it work, partly, which is kind of enjoying the visual of the movements that we're seeing and other people's faces smiling while they're singing. So we can talk more about at the end, and if you're interested in some of our music groups where we do some singing virtually. But yeah, so I want to give us a chance to get back into some active music with a song here. So if you can go to the next slide, what we're gonna try is a song called Up Above My Head. It's a traditional African-American gospel tune, but I think the version that made it really well known is by Sister Rosetta Tharpe. And if you don't know who she is, you should check her out. She is awesome. She did gospel music, but with this really interesting rhythmic guitar playing that a lot of people kind of credit as the precursor of rock and roll. I've heard her called the godmother of rock and roll. And this is a song where, we can also focus on the impact of lyrics, right? So music can be instrumental, and instrumental music can be very impactful, and then you add lyrics to it, and that's a whole other layer of bringing in different themes, of maybe painting a picture or taking us to a different place. And so I want to give us a chance to engage with the lyrics a little bit too. And this particular song also actually, there's some ways that we can adapt it and even bring in some of our own lyrics to it too. And that's something we often will do in our music therapy groups, is kind of take a song and then adapt it to kind of better reflect themes that we've been talking about, or something that we're dealing with, or just expressing ourselves in a different way. So this is going to be another chance to use the chat, which is, once we get into the song, there'll be a place where we can sub in other words. So if you have another word that you want to add, I'll prompt us when to do that. And you can add that in the chat too. All right. And if you don't know this one, this is another simple song that you'll learn. You'll pick it up quickly. And the one other thing I'll say is, if singing doesn't feel right for you today, any of those other options we mentioned at the beginning still apply here too. So I'm going to start us off with a little hum, just to feel the feeling of the singing, the music in our bodies. So we'll go like this. We'll do that 3 more times. If you want to harmonize, you can do that too. All right, I'm gonna get us into the words. I'll sing a line, you can sing it back. Up above my head, up above my head, I hear music in the air, hear music in the air. Up above my head, I hear music in the air, up above my head, I hear music in the air. I really do believe there's joy somewhere. So that part's longer, let's try that. I really do believe there's joy somewhere. Again, up above my head, I hear music in the air, above my head, I hear music in the air, up above my head, I hear music in the air. I really do believe there's joy somewhere. All right, I'm gonna sub in up above my head. I feel the peace in the air. You know, giving a presentation can be nerve-wracking, so I'm gonna bring in some peace for myself and anybody else who needs a little bit right now. So we'll try it again with those words. Here we go. Up above my head, I feel the peace in the air. Up above my head, I feel the peace in the air, feel the peace in the air. Above my head, I feel the peace in the air. I really do believe there's joy somewhere. All right, I'm going to take us to a little B section to give you some time to think if there's something else that you want to fill the space around you with. So the song started with music and then peace. If there's something else that you want to fill up the room around you, the space around you. All right, so we got love. We're going to start there. Up above my head, I feel the love in the air. We ready? In 1, 2, 3. Up above my head, I feel the love in the air. Up above my head, I feel the love in the air. Up above my head, I feel the love in the air. I really do believe there's joy somewhere. We got another one that's up above my head. I see moonlight shining down. Awesome. We're gonna give that a try in 1, 2, 3. Up above my head, I see moonlight shining down. Up above my head, I see moonlight shining down. Up above my head, I see moonlight shining down. Oh, I do. I really do believe there's joy somewhere. Really do. I really do believe there's joy somewhere. Once more. Oh, I really do believe there's joy somewhere. Hey. Awesome. Thanks for joining me on that. I could feel the energy even though I couldn't hear you.
All right. Well, we're going to go into another active music intervention. And again, oftentimes when we're thinking about stress reduction, maybe we're not thinking about these really active things, but given what we learned about music's impact on the whole brain, the music's ability to kind of redirect our attention, imagine what happens if you learn an instrument under the right circumstances, right? With the right kind of guide. So my question to you for the chat box tonight is, of these 6 instruments, which do you think is the most popular clinical instrument used in music therapy at Mass General Hospital? Take a look.
Like
Chat
number
me your
1
guess.
recommended?
Pardon?
I mean, number 1 requested.
Requested, yes. Ooh, I'm seeing some guitars. Oh, yep, someone picked it. it is actually the ukulele. Dun, dun, dun. And I'm not just saying that because I happen to have one right here. This is Little Blue. The ukulele is an awesome clinical instrument for many, many reasons. A, it's adorable. I mean, look at that patient in that picture. She looks so, not just adorable, like hip, like totally ready to go. It's very small, it's very lightweight. There's only 4 strings, so you don't have to think as hard as the guitar, which was a couple of other people's guesses, which is a great guess because a lot of people dream of the guitar, but the ukulele is kind of like their gateway instrument to the guitar, if you will. Also, the strings of a ukulele are nylon and they're really, really soft on your fingers. So all of these reasons are why we use this in music therapy, probably more than any other instrument for clinical lessons at first. But we also do bass guitar, piano, drums. We taught one person the viola. That was tricky. The harp I do a lot of. Keyboard, that's another one. So anyway, the other reason why, look at these 2 chords here, C and A minor. How beautiful is this? 1 finger, and then A minor's up here, 1 finger. Now, I'm gonna push it a little bit. I'm gonna add this 2nd finger to F, and guess what? With those 3 songs, that's right, you can...
Those 3 chords.
3 chords, thank you. 3 chords, 2 songs. So let me show you what this is like. Won't you stay with me? A minor F C. 'Cause you're all I need. Oh, this ain't love, it's clear to see. But darling, stay with me. 'Cause I got sunshine in my pocket, I got that good soul in my feet. I feel that hot blood in my body when it drops. Oh, I can't take my eyes off it, moving so phenomenally. The move on lock, the way we rock it, so don't stop. 3 chords, 2 songs, boom. I'm just saying. Now, it helps if you actually like Sam Smith and Justin Timberlake. If you despise these songs, we will not do these songs because that is contraindicated, if you will. So if you're thinking at home, I love the idea of learning an instrument. Ukulele looks really awesome, but I can't access music therapy right now. What do I do? What's important? So number 1, you want to find the right instrument. Maybe it's ukulele, maybe it's not. So you gotta, check around a little bit. And you want to make sure it's a quality instrument because if it's out of tune or you can't tune it right, you're going to be miserable. But in terms of a good teacher, there's some things that are really important. And all those teachers out there, this is for you. You want to use songs that you like because that will help you connect to it. You want a teacher that can adapt the songs so that you can be successful. You also want a teacher that really pays very close attention like this to how you're playing. Because if I'm like this with my shoulder up here and I develop this habit, that's really going to hurt after a while. And the second you feel pain, that's no fun. And lastly, teaches you how to improvise or jam early on. I think all of these things are really, really important. So,
and one thing that I'll add here too, so this is, describing kind of how we often will teach instruments in our music therapy sessions. But another thing that we often do is use instruments that you don't even have to learn much at all to make it sound good. So harp is actually one like that, when you just go and it just sounds beautiful. We have another instrument called a tank drum that's actually made out of a propane tank of all things, and you basically just tap it with these mallets and it sounds beautiful. So for some people, if they really want to, work on actually learning an instrument and getting some chords down, we can go in that direction. And for someone else who maybe we only are meeting for one time and we're just going to see if we can bring ourselves into music in that moment, it might just be about an instrument that you can play right away. It'll sound good. And our job is to help you be creative and express yourself and feel supported on the instrument without it feeling stressful, because playing an instrument can be intimidating. So kind of using all these ways to bring people into music so that then it actually becomes a way to reduce stress. So as Lorrie was talking about all these instruments we can teach you, and then also the ones that can really just be about coming in that moment and playing.
Hannah, do you think we should give them the secret of the pentatonic? I know you said the word before, but should we tell them the secret?
Sure, absolutely.
Okay, so Hannah, we're going off script here now. We're going a little crazy. So, oh wait, you're reading my mind. Okay, so what Hannah's going to do is she's going to just hold down the sustain pedal on her keyboard and then just play the black keys. Because the black keys on the keyboard are already set up in a pentatonic. So if you're like, I always wanted to play piano, but I don't know how, just hold down that sustain and do what Hannah does.
Maybe I'll add some left hand.
So again, if you have a little bit of rhythm, that helps. The instrument and the secret of the pentatonic can really help you access music very quickly. Well done, Hannah. Good job. Oh, that was awesome.
All right. And actually, since I now have the piano on, it's a good way to transition into this last music experience that we're going to offer, which is really more of a receptive, kind of getting to just take it in sort of experience. And since it is getting into the evening, we figured we would use this as a way to just kind of wind down towards the end of our presentation. And so what I'm going to offer is using the music first as a way to motivate some deep breaths, to breathe along with the pace of the piano. And then I'm going to give us some prompts to just spend some time bringing our attention to the music, hearing what we hear, hearing the patterns, hearing the phrasing, hearing the changes in speed or in volume, and just seeing what that feels like to use the music as a focus for our attention for the next couple minutes. And I'm not going to say more until the end, so I'll start there. All right. So you might take a moment to just get into a comfortable position if you're not already. And you might close your eyes if that feels comfortable, or there's also this image up on the screen if you want to take in that kind of sunset image. I'll just bring in the sound of the piano so we can familiarize ourselves with this. So I'm gonna guide us through a couple deep breaths along with the piano just to see what that feels like. So we'll breathe in here and breathe out. Breathing in and out. One more breath in and out. So you can continue that on your own if the pacing of the music feels right for you, or find the pace that feels right. And now, just begin to shift your attention to the notes that you're hearing. Just using that as a place to continue to bring your attention back to being curious about what you hear. If you find that your mind is beginning to wander, you're getting lost in thoughts, you can just use that as an opportunity to notice it and come back to the sound of the piano. range or a certain color. Just being curious about what it feels like to really listen to the patterns. Just starting to get a little softer, a little gentler. So that before the music closes, we'll just take a couple more of those breaths along with the pattern. And I'll guide us through that. So we'll breathe in and out. And breathing in. You might keep your eyes closed for a moment and just notice the silence after the sounds. And then gently when you're ready, just inviting in little stretches, maybe opening your eyes and coming back. So hopefully that brought a little bit of peace and relaxation in this moment. And one thing that I'll say about that experience, so, in this time I was here guiding us through some prompts, but this is something that you can try with your own music too. So putting on a song that brings you a sense of peace, and seeing what it feels like to really sit and intentionally listen to the sounds you're hearing, being curious about the patterns, being curious about if it's multiple instruments, how the instruments are interacting, and kind of using it as that, giving yourself that space, that break to just tune in with the music. And then if you do find that the guided verbal prompts are really helpful too, I think a couple of the meditation apps that Elise mentioned last week, if you weren't at that webinar, I think Insight Timer is one, Calm is another, and those both I think offer recordings on there that have music combined with some verbal prompts also. So if that's something that really works for you, you can try some of those too. Or you can reach out to us in music therapy and see if we can find some time to do some of that together too.
Thanks, Hannah. That was kind of perfect, I must say. So we really talked about a lot of ways that, again, you could use music on your own. And I want to kind of wrap up with a patient's story. And I want to share this slide, and it's kind of a long slide, but just please indulge me. I'm going to read it. I'm going to share it with you because I think it really captures what music therapy can provide for cancer patients, as well as all of these other ways that music can be used. Entertainment was my first thought when I first heard about music therapy offered in the Cancer Center. In fact, music therapy has been a profound experience, taking me from chemo exhaustion to elation. It helped me cope with treatment in unexpected ways. Chemo creates a terrible feeling in the body and fuzziness in the mind. Music therapy brought clarity and renewed strength and hope, literally moving me from feeling poorly to feeling restored and positively grounded. The songs connected me to a poetry of life's experiences, the instrumental notes moving my body, the words moving my mind. When I joined the group session, I met other people. An appreciation of shared experiences and new thoughts emerged as I got to know these people. I could see others beginning like me, somewhat lost, concerned, or hurting, and coming out an hour later with more connection, direction, and joy. From exhaustion and disconnection to elation and a renewed relationship to life. That is what music therapy does for me. And if that seems like something that you're needing, or you love music, but you want a little bit more help with it, this is music therapy at Mass General Hospital. So again, our services are for Mass General Hospital patients. We see them individually in group services, virtually now, of course. And they're open to all MGH cancer patients or survivors. For our patients in the satellite locations, we do offer virtual sessions. And for folks in Boston, we do see them inpatient and outpatient and also virtually. But the awesome thing is that you can go online and you can log into these virtual groups, which, as you can see, it's actually really amazing to connect to people through this camera, and it works. Our music therapy group started 2 weeks after the lockdown happened. They were like right there and ready to go, and it was pretty amazing. And the live music webinar, which Hannah really gave you a good taste of what that's like, is open to anyone no matter where you get treatment. And this is how you access those groups. You can go to the Mass General Hospital Cancer Center website and go to the website right here, massgeneral.org/cancer/supportive services, and you can get to our wellness calendar. So I'm going to let Devin take it over from here and tell us what's coming up on the Integrative Therapies webinar.
Thanks, Lorrie. So this is just a quick slide showing everyone the weeks coming up, what is on our agenda. So next week we have massage and acupressure for peripheral neuropathy. The following week we have embodying mind-body medicine, followed by the role of acupuncture, looking at fatigue and hot flash management, as well as other cancer treatment symptoms. And we're concluding with a session on yoga. So I hope you can join us. And up top here, you can see the link to register. And again, thank you all for joining us. Again, the Cancer Center website is here. And if you'd like to follow us, there's a couple different social media platforms where there's more information and things going on at the Cancer Center that you can learn about. At this time, we do have some time for questions, and there's been a couple that have come in. Let's see here. How do the instrument lessons work?
That is a great question. Number one, it depends on who we're working with. So if someone is like really, really beginner, we would kind of meet with them, assess what instruments are kind of most interesting, and then maybe let them test drive a couple of different things to kind of, again, see, because the difference between playing a ukulele where you're squeezing versus playing a piano where you're just playing is very different. So we'd kind of meet a patient and see where they're at in terms of how much energy do you really want to focus on this? Do you have any kind of physical limitations or challenges? Are you a really tight person? Then ukulele might actually be tricky for you. So we kind of do this base assessment first. And this is all, again, in the context of a music therapy session, either virtually or in person. And then we just go from there, and kind of like any other music therapy session we do, we build a treatment plan based on what's going to set that person up for success. And I work a lot in the pediatric world as well, and I'm actually doing family sessions where I have a dad learning ukulele with his daughter. So we can make it however the person really needs. So hopefully that answered. If not, please specify if there's more.
And one thing I'll add to that is the music therapy sessions that involve learning an instrument can happen in different places. So one place that we might work one-on-one is in the infusion unit while someone is getting an infusion. So we might actually bring the instrument to you there and do some learning in the moment one-on-one. Recently, we've also been doing that virtually too. So we have that option too. If you're not, receiving regular infusions in that unit, then there's other ways that we can find to connect with you virtually.
And the other thing I would add to that is we do have a limited ability to actually bring people instruments to test drive and maybe take home between treatments. And granted, given the state of the world, that funding isn't always readily available. But when we have that capacity, we definitely like to, because we wouldn't ever want someone to go through the process of getting an instrument when they don't really know if when they take it home, if it actually still is as appealing as when they're in the clinic. So we have our instrument lending library that people have really loved being able to kind of, again, test drive instruments for a little while. Other questions? That was a great one.
That's great to hear about test driving instruments, so to speak. Hannah, you mentioned before a couple other different instruments that one could do in a session. What are some other instruments that someone could try?
So, so definitely there were the ones that were on the screen that Lorrie showed of kind of the classic bass, guitar, keyboard, all that kind of thing. So there's the tank drum, which we use a lot. And then another kind of category of instruments that I think that, are pretty, you can quickly make beautiful sounds are different kinds of bells or xylophones. So we sometimes will bring those in. I've used these handbells that you kind of strike like this and they have this beautiful resonant tone. If some of you have joined me when we did groups in the healing garden, we would, could actually add the sounds of those bells together, and it's a beautiful thing. We'll have to figure out ways to do that more in a virtual setting. But definitely bells are another one where you can get that beautiful sound quickly. Percussion, a wide range of percussion instruments that we bring in, whether that's shakers and maracas and kind of other Latin instruments like a cabasa or a guiro, these different kinds of instruments that you might hear a sound like a something like that. That again, with a couple quick pointers on how to hold it and how to, maneuver it, you can get a really nice sound. So that's a lot of what we're thinking about, is the kinds of instruments that can bring people into music quickly and get us playing and expressing.
Thank you. And I think it was Lorrie mentioned virtual sessions at some of the satellites. There was a question specifically about the Mass General Cancer Center at Cooley Dickinson. Is there any connection or relationship for patients there?
That is a great question. I'm just going to say yes until we find out differently. I know that they are partnered with us. And I think a lot of it also has to do with capacity. So it doesn't hurt to ask. So I think if there's someone there that is interested, I would have one of your providers put in a referral, and then we can begin that conversation, especially because we're virtual. And at the very least, they could always join the groups that are happening. So if for some reason clinically we reach capacity and we have to start saying no to some of the farther out satellites, then we can have that conversation, but they're always welcome in the groups. But again, now I would referral, and you should absolutely see. And the beautiful thing is we partner with Berklee College of Music, and we have a wonderful music therapy intern. And that partnership, because Mass General is a teaching hospital, does allow us to expand our capacity in a really great way. So just reach out and we can see.
And could you talk a little bit more about how someone could get involved? Who can they talk to at the Cancer Center to tell them that they want to begin music therapy?
So really, there's many ways that you can do that. Just talk with your nurse, social worker, doctor, nurse practitioner, and ask them to put in a referral for music therapy. You can type in supportive care, and then you can see our whole kind of cadre of supportive care services and music therapies under there, or they can really just look specifically for music therapy. There's also the possibility on the Integrative Therapies website, there is contact information for the Integrative Therapies, the Gallagher program, and an email there. They could also just send an email to our coordinator, Lauren Annette, and she will get an email to us saying, hey, there's a patient that's interested, and then we would reach out to your staff and have them put in a referral. So, we're very flexible and we're very creative in the music therapy program. So we're going to figure out a way to kind of make it all work.
And one thing I'll say is my email is the one listed on the calendar if you are interested in the music therapy groups. So I'm just going to put it, I can't put it in the chat, can I? Oh, I can. Here we go. So I'm going to put my email in the chat. It's also on the wellness calendar too. But if you want to email me directly, and then I can tell you more about those groups and get you the links for that and everything like that. That's me.
Awesome. Well, I think, are there any other questions, Devin, for right now? Or do you think we should maybe just end with another song?
Doesn't look like there are any other questions coming in. So unless anyone has anything right now, if you want to submit it, because I know Lorrie and Hannah are going to be leading us in a closing exercise. Doesn't look like it, so please go right ahead.
All right. So for those of you who have come to the groups or the webinars before, you'll know this one. But this is something we often close with. It is called the metta chant. So it's actually based on a kind of meditation called metta meditation or loving kindness meditation. So this song kind of it uses the words of that tradition and brings it into music. And it's just a chance to kind of send yourself some loving kindness, send it to someone who you're thinking about, and then sending it out to the world. So we're going to do it call and response. So I will again sing a line and you can sing it back, or you can just close your eyes and take it in. All right, and I like to put my hand over my heart for this one if you want to join me doing that too. May I be safe and hold myself in kindness.
And hold myself in kindness.
May I be well.
May I be well.
And may I have peace.
And may I have peace.
For this morning, we're going to sing You. So if you want to think of someone that you really want to send it to. May you be safe.
May you be safe.
And hold yourself in kindness.
And hold yourself in kindness.
May you be well.
May you be well.
And may you have peace.
And may you have peace.
And for the last one, we're going to sing We, sending it out. May we be safe.
May we be safe.
And hold ourselves in kindness.
And hold ourselves in kindness.
May we be well.
May we be well.
And may we have peace.
And may we have peace.
It can be nice to leave your hand here and take a deep breath in and out. We'll do one more to close. Breathe in and out. All right. And I didn't mention that metta chant is also by the group Daughters of Harriet, which is the song we began with, is also by them. And those songs are both findable on YouTube if you do want to find them too. And thank you so much for joining us.
Thank you everyone for joining us this evening, and thank you Hannah and Lorrie for a wonderful session. Hope everyone has a wonderful night, and hopefully we'll see you some of the next session. Have a good night. Thank you.
Bye.